Hi, Dr. C back with you. This is lesson 34, and this lesson is about expanded pharmacist services. We're going to be covering pages 185 through 196 in your book. Okay, so these expanded pharmacist services, the terminology that I use, um, are the rules that allow pharmacists to do all the things you've been trained to do rather than it's not just about dispensing drugs. So the first one here is one that we mentioned when we were talking about who has prescriptive authority in a previous lesson. And I mentioned to you back then that actually pharmacists in Florida have very limited independent prescriptive authority based on a very old law. So this is that one. It's not used that often anymore. I think what we see more often now are the things we're going to talk about later, such as collaborative practice and so forth. But this is still in the law, and they could still ask questions about it. So this is a law that was passed in the 1980s. It allowed a pharmacist to order a medicinal drug and to dispense that drug to the patient in their pharmacy. The law had limitations on the categories of drugs that could be included on the formulary. There's a formulary of drugs that a pharmacist could order. So the categories of the drugs that could be included on the formulary are listed there on the page 185, and you see a lot of them are referred to OTC products, things that are going to transfer from prescription to OTC, that have already transferred from prescription to OTC, but it does contain some things such as some antihistamines and decongestants that we used to, that are prescription can be on the list. Fluoride products, Lindane shampoo to treat lice and so forth, and topical anti-infectives, which that one actually may be still useful, I think. But there is a formulary of drugs, and you'll notice on the bottom of page 185 that they can only be dispensed by the actual pharmacist that orders the drug. So you don't write a prescription in this case and have it filled at another pharmacy. There are no refills. So you're supposed to evaluate a patient in your pharmacy, write the order for the drug, and dispense the drug. Right? So it's not really writing a prescription that can be filled somewhere else. And there's other restrictions, such as there's no refills, and we'll go through some of the other restrictions a little bit later. You do have to label the products, so labeling is always important, as I mentioned. This one has its own labeling requirements on there. You can see those listed on page 186, number 3. What was important at the time this law was passed, like I remember that, is that you are eligible to be reimbursed, right? So that's always a big part of these things. Sometimes we get these authorities, but we have the authority to do things, but there's no mechanism to get reimbursed for it. So this one specifically said that they're eligible for reimbursement. Whether you actually can get reimbursed or not may be another question. Some other restrictions you'll see there on number 5 on page 186. It cannot include injectable products. It can't be for a patient who is pregnant or a nursing mother. The quantity that is provided can't exceed a 34-day supply. Now you might be wondering, why is it 34 and not 30 days? I'm not sure, but I think it's related to the Medicaid rules at the time, or maybe they still are, based on a 34-day supply. It can only be done in a permitted pharmacy in Florida. You do have to create a prescription, it says, but remember that prescription can't be sent out to be filled somewhere else. You have to maintain a patient profile and keep those records for 4 years. And here's the actual formulary in the rule of drugs that are on the list. If you see anything exciting there that you want to actually prescribe to patients in your pharmacy, you can do that. The formulary is listed for you on pages 187 to Okay, on page 188, we have the next expanded practice for pharmacists, and this is called drug therapy management, and the rule for it is 27.830. Make sure you read the note that I have there, because this rule was put into place prior to the 2020 collaborative practice rules and the test and treat laws. So, but it wasn't taken away. So we've got different areas where you can do these expanded practices. And I actually have put together a summary chart of all these expanded practices in the back of the book in Chapter 7, which I think will help explain them, because we have different rules for these different types of authorities that pharmacists have. This particular one says that pharmacists can provide drug therapy management when they're working with orders in what's called a prescriber care plan. And the prescriber care plan authorizes pharmacists to do things like order laboratory tests, interpret those laboratory tests, execute drug orders for a patient based on the prescriber care plan. The problem with this particular provision was, if you see on the top of page 189, you have to have a prescriber care plan for each individual patient. You have to have orders for each individual patient. And you'll see on the top of page 189 that it can only be provided at a pharmacy permit that has a transferable patient care record that includes a prescriber care plan with a section noted as orders from a prescriber. So this is only done in certain healthcare clinics that had a really good working relationship between the physicians and the pharmacists. And the limitations of this, I think, are what led to the more broadly practiced collaborative practice, which doesn't have all these restrictions about a transferable patient care record. But this is drug therapy management rule. Probably is not going to be used much anymore with the collaborative practice one we have, although it might, because this one, you're allowed to do it without any specialized training, whereas the collaborative practice one actually does require a certification before you're able to do the collaborative practice. Okay, on page 189, we see the rules for collaborative practice. It's actually a rule as well as a statute. This is legislation that was passed in became effective July 1st, 2020, and I think the certification and approvals were done by the board in late 2020 or early 2021. This allows a pharmacist to manage chronic healthcare conditions under a collaborative practice agreement with a physician. The law itself lists the specific chronic healthcare conditions that can be managed by a pharmacist under this law, and those include arthritis, asthma, COPD, type 2 diabetes, HIV and AIDS, as well as obesity. And then it says any other chronic condition adopted by rule. And the Board of Pharmacy has adopted a rule to add onto that list hyperlipidemia, hypertension, anticoagulation management, and if you turn over to page 190, nicotine dependence and opioid use disorder. Now, in order to do a collaborative practice under this law, the pharmacist must be certified. And the requirements to become certified are listed for you on page 190. The main thing is you have to take a 20-hour certification course that's been approved by the Board of Pharmacy in consultation with the Boards of Medicine and Osteopathic Medicine. And all the specific requirements of that course are actually listed for you on page 190. It can be very, very specific. I think out of the 20 hours, not less than 8 of the hours have to be a live webinar or video conference as well. Other requirements in order to practice under a collaborative practice agreement, on the top of page 191, you must have $250,000 of liability insurance. It's different than the one for vaccines for some reason, which only requires $200,000. I think most policies cover you for, usually for $1 million. So you should be covered, but you need to know the differences for the different types of programs. You have to keep records for 5 years, so it's a little bit longer than the general 4-year requirement. So take note of that in letter F on page 191. And then what do you have to have? You have to have an actual agreement. You must have a collaborative practice agreement. And all the requirements for the collaborative practice agreement, they're pretty detailed, but they're all specified in the law itself. And they're listed for you on page 191. I think one of those is slightly problematic, and that is 4A1. Not only do you have to have the name of the collaborating physician's patient or patients for whom you're going to provide the services. Well, you may not know that initially, but the problem is you have to submit a copy of the collaborative practice agreement to the Board of Pharmacy before you actually start doing this. So I think maybe a workaround for that might be that you can either put one patient name that you're going to start with, or maybe you can put, patients to be determined and then submit that to the board for approval. And then once you start doing this, you can add patient names to the protocol, maybe in an addendum, because the board does say that when you change an item in a collaborative practice agreement, you can do that with an addendum, and you don't have to send each addendum to the Board of Pharmacy. You just keep a copy in your pharmacy. So that might be a workaround for that particular issue. There is an automatic termination of the collaborative practice agreement after 2 years if you don't renew it. So make sure you keep your collaborative practice agreement up to date and renewed every 2 years. As I mentioned on page 192, you have to submit a copy of the signed agreement to the Board of Pharmacy before you actually start. And then if you're going to make an addendum of any of the material terms to the agreement, and the material terms are all those listed as being required on the previous page, you don't have to send the addendum to the board. You just kind of keep a copy of that in your pharmacy. There are some limitations there. Number 6, you'll see you can't modify or change drugs that have been prescribed by a practitioner who you don't have a collaborative practice agreement. And of course, if you're going to enter such an agreement, you have to have permission from the owner of the pharmacy where you happen to work. When you renew your certification to do a collaborative practice, you must have 8 hours continuing education course approved by the board as well. On the top of page 193, you will also see that if you are engaged in collaborative practice and you encounter any reportable diseases, such as certain infectious diseases or outbreaks, there are public health reporting requirements that you must follow as well that apply to really any type of practitioner that's treating patients. So at the same time we got collaborative practice, that law also allowed pharmacists to do testing and treating for minor non-chronic health conditions. So remember, collaborative practice allows you to manage a patient's therapy and drugs for chronic conditions, but test and treat is kind of the opposite. It's for minor non-chronic or more acute conditions. Again, you've got to be certified to do this. And we'll go through the certification in just a moment. But minor non-chronic health conditions are defined as typically short-term conditions managed with minimal treatment or self-care. And there's a list of those, and they include influenza, streptococcus, so you can test for strep throat and then prescribe for strep throat as well, lice, skin conditions such as ringworm and athlete's foot, and minor and uncomplicated infections. So again, you have to be certified to do test and treat. The certification requirements are very similar to the ones for collaborative practice. On the bottom of page 193, you can see it's a one-time 20-hour course that's approved by the Board of Medicine. Approved by the Board of Pharmacy, but they have to consult with the Board of Medicine and Osteopathic Medicine to approve those courses. And then the very specific requirements for the course are listed on the top of page 194. Again, you need $250,000 worth of liability insurance if you're going to engage in this type of practice. And then the law says that the Board of Pharmacy shall adopt a rule that has a formulary of the medicinal drugs that a pharmacist can prescribe to treat these minor non-chronic health conditions. So we saw a formulary of drugs under that old law that pharmacists could order. Remember, there was a lot of OTC types of drugs, nothing too exciting there. The board this time took an interesting approach, and you'll see it on the bottom of 194. Board Rule 31.039 was adopted, and it basically says that the formulary of drugs is all approved FDA drugs and all compounded medicinal drugs that use active pharmaceutical ingredients that are approved by the FDA. So that's kind of interesting. They didn't want to limit the drugs. So it's all medicinal drugs. Remember, medicinal drugs are prescription drugs, but do not include controlled substances. You cannot prescribe controlled substances, so pharmacists do not have their own DEA registration in Florida. You'll see the types of tests you can perform listed on 195, and it's basically any of the CLIA waive tests under the CLIA, which is the Clinical Laboratory Improvement Amendments, are the tests that a pharmacist can administer under this particular provision. Then number 7 on page 195 tells you the minimum requirements for the actual protocol that you're going to be operating under. Notice this one does not require you to list specific patients. So this one is categories of patients that you're authorized to test and screen for chronic health, non-chronic health conditions. So this could be walk-in patients as long as they fit the proper categories under the protocol. This one you have to submit the protocol, the written agreement to the Board of Pharmacy within 5 days. A little bit different than the one for collaborative practice. And again, if you amend your agreement, you just have to keep those amendments in your pharmacy. There are some additional requirements on letter D on page 196. Just to advise the patient that they have to seek follow-up care with their primary care physician. This has extra protection that must be provided, I believe, in writing to the patient. Yes, it is in writing when you do this type of test and treat service. Okay, so those are what I call expanded pharmacy practice rules. And as I mentioned earlier, I do have a summary of these to try to kind of compare and contrast them for you in one of the charts in the back of the book in Chapter 7 that may be helpful when you're trying to study and keep these different programs separate in your mind. That's it for this lesson. We will pick up again on page 196 and talk specifically about community pharmacy practice rules.